So you're timing me for 5 minutes? All right, sounds good. All right. So your left shoulder's bothersome, correct? Right shoulder. Okay. And that's bothered you again after you had some recovery? How long ago?
Oh, it's started probably in October. And I did a cortisone shot before Christmas and physical therapy.
Got it. And then that kind of relieved it? Ish?
But
Still
I
bothering you?
got to the end of the therapy, it would get paid for, and just figured it would go away.
Got it. And did it go away the rest of the way? No. Get a bit worse or stay about the same?
It seemed to get worse because I got a job with a bad desk, so it kind of redid it, so then I got a better chair and been a little better, but still.
So what's it bothering with you right now? What's the things?
Sleeping, and then just like trying to change. Sometimes just sitting there, it just hurts, just aches.
Got it. Again, rest, keep laying your side. Tough to reach back, tough to reach forward. If you would please, I'm going to have you reach up. So that's barely, not quite getting to 90 degrees. I'm going to take a measurement here, right? And that's bothersome, or it's just stiff?
That's real tight.
Okay. And then up to the side, if you would please. She gets that up about 45 degrees. You notice she starts to hike her shoulder blade a little bit. She's raising her arms. She's got to move from somewhere. She's going to move, right? And now your other side, reach up with your left as far as you can. Way up, good. And back down, other side, way up. Okay, thank you. What I'm going to do is I'm going to have do a couple tests here. So bring your elbows in. We're going to check the integrity of the rotator cuff muscles, right? So she could have more than one thing going on. So you're going to bring your hands out a little bit. Maintain that up. Don't let me move you. Don't let me move you. Good. Testing external rotators. Put your hand in your tummy. Bring your elbow forward. Keep your elbow forward. Keep your hand in your tummy. Don't let me move you. Good strength there. Outstanding. Raise your arm up a little bit. Checking another rotator cuff muscle here. Up. She's got stiffness. We're not going to go up that far. So she's got good strength there. Hold here. Don't let me move you. Don't let me move you. Good. And now come back. Touchdown. Not much motion there. She's struggling there. Keep it back there. Keep it back there. Hold. Don't let me move you. This is testing the smallest of the rotator cuff muscles, the teres minor. She's strong. Don't rest. Lots of brothers growing up or something. Mary, whooping up on the husband.
Yeah.
All right. So this is a stiffness problem, right? She doesn't need dumbbells in her hand, right? Do you get pain below the elbow at all?
Occasionally. Yeah.
Nothing?
Yes.
So I kind of brought her neck earlier, right? So you can imagine if she doesn't have the motion here, she's got to do it somewhere else. But this is a shoulder rotator cuff problem. You might mind grabbing it. So one of the things I want to do is see how much true motion is in that ball and socket joint. Because when I raise my arm up, to the side, my shoulder blade can move, but if I block my shoulder blade, I want to see how much movement is in the elbow. I'm going to block your shoulder blade to test on this side. And ideally, if I block that shoulder blade, this elbow should come up to about her earlobe. And it's interesting, she is fairly stiff on this side too. The elbow barely gets up to her shoulder. Got your shoulders on this one too.
That was my first frozen shoulder.
That was her first frozen shoulder. So did she have
That was from an injury.
injury? Did she have to recover on that side? And her hand can't go back all the way, right? So she's left with some residual stuff there. Like, I don't know if it stopped improving or she stopped working for improvement or what.
So did the right side of her body try and compensate for the left side of her body, and therefore now she's more equally screwed up?
Maybe, I don't know.
I don't mean.
Should ask her husband if she's now developed a better right hook because his left hook is
Well, it's just, it seems that, everything's connected, so the body wants to be synchronous.
For sure. But I'm gonna block her elbow here and I'm gonna try to stay out of the way here as much as I can. There's about
That's gonna hurt.
30 degrees of motion. Not bothersome though, no. Hand coming back, not so much, right? So, very stiff shoulder, right? I'm not sure how much I'm going to be able to provide a miracle in 5 minutes. I better get close to 4.5 minutes here. She's timing me. How am I doing so far?
5 minutes.
5 minutes?
Yeah, we've been doing more talking than actual physical.
There we go, yeah.
How about
The
that?
audience is distracting me, I like that. So, if you can't see, I've got to get in position here for me to be comfortable, so if you want to move a little bit, you can. So I'm going to do some light joint mobilization techniques. So my intention is to help just that ball and socket, see if we can do some gentle, easy motions to help get this thing to relax a little bit.
So you're actually encouraging the muscles to move.
Stand up for this. So everything here should be comfortable. Fair enough?
Well, comfortable enough.
Pull a little bit on her arm like Gumby. Do a little bit of joint mobilization. How does that feel? How much force am I using?
So what you're doing is you're isolating the movement so that there's no compensation from somewhere else to hide the movement.
In the ball and socket joint, I'm trying to loosen up, working to loosen up that joint a little bit, rising. Do a little shift in that joint a little bit. Comfortable?
Are you experiencing any tingling?
No.
I'm sorry, I'm asking questions,
Okay.
but
We're gonna do a little muscle activation here to help with this. Maintain yourself here. Don't let me move you. Don't let me move you. Good. Maintain yourself here. Don't let me move you. Just get some muscle activation, get more relaxation through that joint so it can be a little more effective. Again,
and is that also
using
increasing the
muscle-
blood flow? Okay, sorry. I got lots of,
increasing the blood flow and allowing for, because we're isolating muscle activation, we can allow for relaxation. Because her arm is bothersome, right? So she's gonna have some spasming, some irritation going on.
and so the body's gonna go, oh, great! Whoosh, 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 whoosh. With all the healing stuff.
Yeah, right, let your elbow rest, right? And again, you know, she already knows that recovery from frozen shoulders takes time. You're
Yeah,
not gonna get 5 degrees within a session.
5 degrees is a lot.
Yeah, for sure. We're
Yeah.
happy to get that, right?
But then it's maintaining that and then increasing, and that's
So
where
then-
you have to keep coming back. Sorry.
Yes. So yeah, of course, it's not gonna be a one.
I don't know anything about this stuff, so that's why I ask some of these stupid questions.
That's great. Just follow logic. So one of the things that can happen with rotator cuffs is they can be aggravated, they can be irritable. So we don't want to irritate and overdo the dosage, right? So we don't have to do a lot more than that. I don't know what kind of change is going to go on with her, right? But I know this, I probably didn't hurt her. She might be willing to come back and see us again. I don't know. I'll leave that to her, right? At first do no harm, right? I don't want to jack this thing up because any inflammation or irritation can actually work to tighten things up because we know that's one of the things that inflammation does.
Yeah.
So don't wreck it. Is the goal of this frozen shoulder. Properly assess it, right? She's got both sides of it frozen. Like for my liking, I'd want her to have a little more mobility on the other shoulder. I'd probably have a conversation. Hey, you're gonna get a little more improvement on that side too. She'd be like, yeah, maybe. But let's focus on this one first. Have a seat, please. Nice work. Cool. Now we'll
Thank
see.
you.
Now we'll see if what difference, if any, the take was. Again, we didn't take strict measures here. And again, we're not expecting a massive change here necessarily, but we're just looking for whatever we know. So reach up again. And come back down. Compared to before, what's that like?
Not as tight.
Not as tight. And
So-
up to the side, if you would. That's a lot more.
Yeah, that's
Y'all
more.
can see that, right? So, good. Nice.